So thank you all so much for joining today. We are so excited to be with all of you. It is amazing to see your beautiful faces and that so many of you have joined from everywhere. So with us, we have our wonderful medical advisor, Jerry. So she's here. Jerry, do you want to give a wave?
Hi.
Yes. And we are so excited to be talking with you all about the realities that you're facing every day. You are working in very difficult settings, in very difficult circumstances, and we are so impressed by your strength and your resilience and your commitment. So Jerry, would you like to introduce yourself?
Well, good afternoon, Nigeria. It is so good to see you all. And I just want to let you know that I am so pleased to be able to speak with you this afternoon. To give you a little information on my background, very briefly, my nursing background is in general nursing, in medical and surgical nursing, and public health nursing, for which I have had the opportunity in the past to work with the light. So I'm doubly excited to meet you all, and hopefully we'll have a good session.
So thank you so much, Jerry. Since there are so many of you on the call, we would love to take the opportunity for each person to give a very short introduction of themselves and tell us a little bit, very briefly, maybe just 1 minute, about the community that you work in and the work that you do every day. Does that sound okay, Sister Augustina? Here, sorry, I'll unmute you.
Maybe we'll make it 2 minutes.
Okay, we will do 2 minutes per person.
Okay, so am I to begin?
Wonderful, please.
Okay, well, I am Sister Augustina Okorafor. I'm a Nigerian and I am speaking from Nigeria. I work at the National Secretariat of the Nigeria Conference of Women Religious in Nigeria. I serve the major superiors and the sisters in Nigeria as the executive secretary of the conference. And the National Secretariat is situated in the eastern part of Nigeria in a city called Enugu State. So well, down this way, because of the lockdown as a result of a COVID-19 pandemic, a lot of people actually seem helpless. We discovered that some people do not have the right information, and so they would like to know, we would like to give them the right information about COVID-19, things they need to do to protect themselves, and things we also need to do to protect ourselves. And a lot of them, I tell you, are hungry, and they wouldn't even want to listen to us. They want us to give them food. And that is where I'll stop for now. Thank you.
Let's see, Sister Gloria, would you like to go next?
Yes, my name is Gloria Ozuloke from the Congregation of the Religious Sisters of Charity. I reside in Satellite Town, Lagos. And my major work, I'm the project officer for Religious Sisters of Charity in Nigerian region. So I go around all our projects, wherever it is being located in Nigeria. So I ensure that I make resources available to them through our congregation and other means available for the projects in order to reach out to the most vulnerable people, especially in rural areas. And my community is Lagos, where I'm residing. Yes, regional house. But without the lockdown, I would not have been most of the time sitting here or doing some other work. I would have been traveling, but for the COVID-19, we are here, but we are very busy as well. We haven't been doing projects and proposals, so that has been my work for now. And the needs in this area, generally in Nigeria, we have preventive and therapeutic needs for the COVID-19 because even though Lagos is the epic center, but having always also engaged with our sisters in other ministries, the needs are similar, even though they are not badly hit because the price of food is very high. The common people cannot afford, the poor suffer. So the needs are huge. So I will stop here. Thank you.
Sister Yevis, would you like to go next?
All right. Good afternoon, everyone. Yeah, my name is Sister Yves Okechukwu from the Congregation of the Holy Family Sisters of the Native. I am joining this meeting from Abuja, Wuse 2 precisely. Hope you can hear me.
Yes.
All right. So the work I do in this part of the country is a sort of hospitality work. I work in a social center, Catholic social center. It's a pastoral center that is available for everybody. We have our rules and regulations here. Once you meet up with the rules and regulations here, you are free to lodge. It's a sort of hospitality accommodation that we offer to people. Right now, due to this COVID-19 issue that we have here, or pandemic we have here, so many people or so many persons are afraid to come to such establishment to lodge. And we too here, we found ourselves being more vulnerable to this pandemic. Whenever we see someone coming in to lodge, our hearts will always jump. Will this person test positive, or will this person be negative or whatever? Though we have some strategies we have put in place at the gate to at least to ensure that those coming in are safe. But you don't know how real and how authentic all those machines are. So we see ourselves here being more vulnerable, but we are being more careful to that. Then coming to people around us here, we are faced with a lot of challenges. As God has rightly put it, many people here are uninformed. Once you talk about COVID-19, they don't really understand what it means. Some are saying that it is scam. When you tell them the reality of it, they said it's not true. It's all about making money. So we try to create awareness, but it falls on deaf ears. Then talking about social distancing here, you are not talking to anybody. You are on your own. Then we are having, every time, stories about banditry, going in to steal because of very much hungry. So it's a very big problem for us here. And then they are also taking it as if they are giving fake news and fake information here in Abuja. So we are trying our best to see how we make things, tally and go in line with what this COVID-19 is all about, so that we will also reach out to them. Thank you.
Thank you so much, Sister Yevis. We appreciate you. Sister Bernice, would you like to speak next?
Sister Bernice Atumei. I'm Sister Bernice Atumei of the Congregation of the Sisters of Our Lady of Fatima, Jos, Nigeria. And I live and work here in Jos. Jos is of the north central part of Nigeria. And the congregation is into teaching, into health ministries, and into social pastoral. And presently, I'm the financial administrator of the congregation, managing the finances of the congregation. Here in Jos, it's really difficult because once there is a lockdown, people try to be obedient and stay back at home because of the COVID-19. However, people's monies are in the banks and it's difficult getting into the banks. The banks are allowed to open only on Fridays. And then it's not all the branches of the banks that open on Fridays. So it's difficult for people to get into the banks, to get their monies, to get the food they need, to be able to stay back at home from one weekend to another weekend, because our lockdown here lasts for a week. So the people are really hungry. When you ask them to stay back at home, how do they survive at home? And even when the lockdown is relaxed on Friday mornings, it's only people who sell food items that are allowed to open their shops. What about those who sell other items? How do they sell their items to be able to get the money to buy the food? So these are the issues we are having here in Jos. Thank you.
Thank you, Sister Bernice. Sister Cordis, would you like to share next? Yes, please, Sister Cordis.
No, my name is Sister Cordis Mwefo. I'm of the Handmaids of the Holy Child Jesus congregation, and I'm speaking from Abuja, FCT, Nigeria. I'm living and working in the town called Gariki. I'm a teacher by profession. The schools are locked down, but we're engaged in online teaching. And it's not easy. I've been on my feet because I journey with the teachers. I link myself up in all the classes to monitor what they do as the head teacher of the school. And around us here, people are dying of hunger because of the lockdown previously held. And now there is a big relapse of the lockdown. I went out today. People are moving about, no masks, nothing concerns them, even interacting, no social distancing because of hunger. They are there begging for food. So life is not easy. Calling their attention to observe the law put down or putting on their face masks and being aware of the cleanliness, like washing of hands, using their sanitizers, to say what they need is food. We should give them food. And my community is along the road. Since this issue of COVID-19, the community has been assisting the poor people who come along the road to beg for food, because you can't see them being there the whole day without food and close their eyes and heart. It has not been easy on our own part, but as a community, we have been doing our best. And we women religious of Abuja, through the appeal of the Archbishop, also made our own donations. Like today, we had a conference meeting of the executives of LCWR Abuja area. We heard it this morning to give ourselves the update. So life here is not easy, but God has been good. And we pray that people will accept the reality of COVID-19 and be careful, because almost every day you see people stumbling and people getting more worn out. So I'll stop here for now. Thank you.
Thank you so much, Sister Cordis. We appreciate you. Sister Felicia, would you like to go next? Oh, sorry, I'll mute you. We can hear you now.
My name is Sister Benedicta Aiden. I'm from the congregation of the Infant Jesus Sisters. I'm from Nigeria, residing in Taraba, Jalingo. I'm speaking from my community in Mile 6 in Jalingo. I'm a teacher working in a women vocational training center, working with young women. I think since the lockdown or since the COVID-19 pandemic, the school has been closed. So we are at home. I'm not doing anything at the moment. I'm working on the farm and doing small things around. Our problem here is our people here, I think they don't believe that the COVID-19 exists. Like they believe it's a scam. The government is trying to make money using them. And so like most people, you cannot talk to them because they don't listen. They tell you, we want to see who has the disease. If not, we will not believe you. And when the lockdown is released, like we have so many people, the market is packed full, like no social distance, like the market is so packed full because everybody is in a hurry to get what to eat, that like you don't know what to do. You are just lost, don't know how to help the people. The problem with our people here is poverty, no money, because some people earn their wages daily. So if there's a lockdown, it means there's no way to feed the family. So that is what we're suffering with here. Thank you.
Thank you so much, Sister Benedicta. We appreciate that. It looks like we have Sister Felicia Adeola. Yes. If she would like to go next, I will unmute her.
You got it. Greetings from Ekiti State, Nigeria. I'm Sister Felicia Adedoyin Adeola, a member of the Sisters of St. Michael the Archangel, founded in Ado Ekiti. I work in Ado Ekiti. I am a teacher. I work in a secondary school as the vice principal of the school. Hello, can you hear me?
Yes.
Yeah.
Yes, Harriet.
Yeah. This devastating situation came around March, towards March ending. It was so devastating because that was when the students are preparing for the second term examination. It was like a joke. The schools had to be locked down. Students have to go home. I work in a boarding school. It was so devastating for the whole school, getting the parents coming down from different parts to pick their children. This COVID-19 has actually affected every part of human system, socially, economically, physically. Talk of it. At the onset of this problem, people were still trying to move about. It got to a stage that nobody can go out again. There's what we call lockdown everywhere in Nigeria now. The problem at this part of the country isn't that people don't believe. People believe, but they are asked to stay at home. It is somehow difficult for people to be confined in a place for a very long time. Based on the cases recorded here in Ekiti State, Nigeria, a good number of us believed that this COVID-19 is real. But the problem we are encountering here is that people are hungry. They have to go out. they are forced to go out, even when they are being charged to pay fine and all sorts. Out of nothing, they are still being charged to pay certain things when they go out and they are caught. Things are very expensive. I'm telling you, so many things are escalated because of this COVID-19. People cannot even go to market as they want. At times, we wish to help, but we don't have much to also help people. So please, I don't know how you can come to the assistance of common people in this environment. The precautionary measures are taken to consideration, but people still have to eat. So how do we find our way around getting people a bit okay in their environment so that this COVID-19 of 18 can be arrested? Thank you very much.
Thank you so much. And yes, we hope that some of what you'll learn today will help start to provide for that support. Thank you so much, Sister Felicia. We have Sister Catherine. Would she like to speak? Oh, looks like maybe her sound and video has paused, so maybe we'll just jump to Sister Patricia.
Hello, can you hear me? Hello?
Yes.
Yes, we can hear you.
Okay, all right. I'm Sister Patricia Dow. Sorry, I came online late. I was having difficulty with the bandwidth of network. So I'm Sister Patricia. I'm a Dominican sister. I work in the far northern part of the country, Sokoto State. Sokoto State is around the extreme northwest of Nigeria. I work as principal of a secondary school and coordinator of Industry Primary School. For Sokoto State, the big problem we have here, or challenge, is the fact that the people are still living in denial of the fact that there's COVID-19. Schools were locked down. Yes, only schools were locked down. Everywhere is busy. People are going about their normal duties, except school starts, were locked down. So that is actually the problem. The main problem we have here is making the people understand that this thing is real, that it is real, and the need for them to take the necessary precautions. Because, you know, in the far north, we have this system, this thing they call the Almajiri system, where children are taken to Islamic schools to learn, and you see them on the street begging. They live under very harsh conditions. So that is another problem.
Sister Patricia, are you still there? Was there anything else you wanted to say? We may have lost her sound. So I think what we might do is then go to Sister Catherine. It looks like you're moving now. Can you hear us?
Yes.
Wonderful. If you would
Yes, I can hear you. Good afternoon, sisters. I'm speaking to you from Abuja, the Congregation of Missionary Sisters of the Holy Ghost. Here we are working with in a school, a boarding school. So since 23rd of March, the school is locked down. The children have gone home, and we go around. The environment we are living is an environment where we have local people who do not even believe that there is COVID-19. And the worst part of it is that with the high prices of food, most of them go about looking for somebody to help them. And we try to educate them to realize that there is this devastating sickness that is around. Because for them to go around, no social distancing, doing their work, they don't even wash their hands, they don't use face masks. So this is the sensibilization we are doing with them. Thank you very much.
Thank you so much. So we have someone else on video that I can't see their name of. Would that person like to speak?
What is Jovita?
Jolita?
Jovita.
Jovita. Sister Jovita, would you like to speak?
Okay, thank you very much. I bring you greetings from Anambra State, the eastern part of Nigeria. I am Sister Jovita Ochi of the Congregation of the Sisters of the Sacred Heart of Jesus. I work here in this part in a hospital, and we serve different communities here, different villages. Divine Mercy Hospital, Okofia. Okofia means thick bush. That is the meaning, thick bush. And that is where we work in a hospital here, Maternal and Child Health Center. And rendering different medical and surgical services here with this COVID-19 is really very challenging. We have different areas of need here as a result of this COVID-19. We do not really have the equipment to either protect ourselves as we work in the hospital, because at some point in time, even the teaching hospital had to close down, they had to shut down their services, and they limited their services to
Sister Jovita, I am so sorry to interrupt. There seems to be a loud like ringing noise on your end. I'm wondering if maybe you could type your response into the chat.
So you cannot hear me?
Not very well. What I did catch is that you work in the northern part of Nigeria in a hospital. But if there's anything else, maybe you could type if that's okay. Thank you. And now, is there anyone else on the call that I did not, that has not spoken yet? It looks like we actually do have Sister Juliana not on video.
I don't know why I'm not on video.
Sister Julie? Sister Julie?
Yes, I'm here.
Now, check your system
yes.
by your left side.
Can you see me now?
Okay, good, yes. So just briefly introduce yourself. 1 minute.
Okay. Good evening, everybody, and good morning to Leah, because I know it's still morning over there. I am Juliana Oluwakemi Oshiemi. I'm a sister of the Eucharistic Heart of Jesus. I work here in a retreat and conference center in a rural place called Ogara in Delta State. Delta State is in the, it's one of the oil producing areas in Nigeria. That's where I work. We have an orphanage. we have about 13 children in the orphanage. Then we also have a retreat center. Our sisters and some other sisters from other congregations do come there for their retreats and seminars, workshops, all kinds of things that help their spiritual growth. So I'm a member of the team here, and I do give a lot of workshops, seminars, like when we have the sisters who come here for the 10th-yearship program, that is the sisters preparing for final profession. I do give them lectures on religious life, on leadership, you know. My lectures cut across anything that has to do with topics that have to do with religious life. That's basically what I do here in Ogara. I'm equally a member of our administrative team in Lagos. So very often I travel to Lagos for our team meeting, for administrative meeting. I'm a member of the council. I also, because I'm a member of the council, I also double as the councilor in charge of formation. And that means also visiting some of our formation houses, particularly the scholastic kids. I go there also to teach them. I was lucky the lockdown didn't meet me there. I just finished the lectures, then I came back and this lockdown of everything started, and I've been stuck here for the past 1 month or so. I can't move. Usually I'm a moving person. I always travel for one meeting, one thing or the other. That's, in summary, what I do.
Thank you so much, Sister Julie. Is there anyone that was missed? I think there's someone on the call that is listed as HP Folio. I'm wondering if that might be Sister Antoinette, potentially. Is that Sister Antoinette on the phone? It's okay. I think maybe at this point, we will, oh, sorry, I see here Sister Jovita has added in the chat. I am Sister Jovita Ochi of the Congregation of the Sisters of the Sacred Heart of Jesus. I work in a village called Okofia, which means thick bush, in Anambra State in the eastern part of Nigeria. I work in a hospital that renders maternal and child health services. Thank you so much, Sister Jovita, for taking the time to type that out. That is wonderful for us to know. Thank you. I think at this point, we will hand it over to Jerry for the emergency planning session education. Does that sound okay with everyone?
Hello, Leah.
Ah.
Please, can I say something?
Yes.
I actually wanted to apologize for joining in late. I've been here since 3:45, but I was finding it difficult to log in because here where I'm is a rural area and the network can be very, very poor. Plus that we have not had electricity in the last 4 days. So I just pray this computer doesn't go off before we finish this meeting.
It's okay, and thank you for bringing that up. We understand that there are technology issues, and that is okay. I'm actually recording this call as well, so if anyone drops or has trouble hearing throughout, I can send a copy of the recording to make sure that everyone has the information.
Okay.
Wonderful. Over to you, Jerry.
Okay, thank you. I am going to share my screen. Can everyone hear me all right?
Yes, we can hear you. I can hear you.
Okay, great. Oh, now I'm having difficulty. Hold on. Okay. Can you see my screen now with the blue tab?
Yeah.
Yes.
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 I was on full screen, which is better, for everyone to see,
If you
but
go
I,
to, if you go to slideshow, sort of top middle,
okay.
on slideshow, do you see it in the top middle? Yes. And then from
Yes,
beginning,
from what?
from beginning should work. Yes.
From beginning. Okay. Oh, great.
Perfect.
Okay. Okay, this is the first slide of my presentation. And hopefully this will answer some of your questions about the COVID-19 pandemic. We are realistic about your situations, but it's good to hear specifically what you're dealing with. Keeping that in mind, this presentation will give you a bit of a background in helping teaching people who are in disbelief or denial, and also help you in ways to deal with it. Everyone's on board, yes?
Yeah.
Yes.
Okay, this is our agenda for today. And as you can see, the first item is introductions. We have made our introductions. Thank you all for that. It was wonderful. I've learned very much from you sisters who are on the job, doing the job, and maintaining yourselves in your situation and location. And I thank you for that. So I'm going to move on to key messages about COVID-19. Coronavirus disease, COVID 2019, is a virus. And we all have knowledge of a virus and what a virus is and how it works. This COVID-19 virus is unlike the flu. It is not the same type of virus. It is not even on the same level of the flu. The flu we can basically treat and we get over it. This virus is new. Humans have never had to be exposed to this coronavirus. It is an unknown new virus, and it affects all ages, all races, globally. It doesn't matter where you live, you can be infected by this virus from other people, or you can infect someone else. So we all have to work together to take care of each other, because this virus is going either way and it is very dangerous. Where did the virus ultimately come from? That's a question mark. There's research that the greater horseshoe bat probably caused the 2003 SARS virus and possibly COVID-19. And I'm sure in future we will hear more about where this virus has come from. Now, this is a map showing you the global pandemic results of this virus. Where you see the red circles, it is full-blown viral infections, and it can be mortal. The virus has spread from Asia to Europe, to the United States, North America, South America, Africa, and Australia. But as you can see, it is much worse in other places than in Africa. So it is starting in Africa. which is probably why a lot of people, your communities and your neighbors don't believe it. But it is coming. We are trying to prevent it from being as diverse an epidemic in Africa. And prevention will keep Africa from becoming like the other parts of the world. It has not yet overtaken Africa, so you can clearly see the virus affects anyone. Any person exposed can pass it on, and we can pass it to each other. That's why the protocol is to wear a mask, wash your hands, and keep yourself protected, no matter what your race is, no matter where you live. The virus is now COVID-19 is very different from the standard seasonal flu, influenza A and B, as I've said previously. It is not the same virus. It is a totally new virus, very dangerous to humans. And the death rate by age seems to affect more elderly people. So if you are from the age of 60 to 80 plus, normally because of other underlying conditions, because of the age of the person, it affects the aged and senior citizens much more than the other age categories. So you can see on the right side of this graph, there's 0.2% for anyone from 10 years to 39 years. It goes up a couple of percentage points for 40 to 49. It goes up from there from 50 to 59. Once you hit 60 to 80 plus, it is much more dangerous. And a lot of those underlying risk factors I will talk about in a moment. Why is COVID-19 spreaded so quickly? It is a respiratory infection, and it can transmit the virus during the incubation period. You can actually have no symptoms and still transmit the virus to someone else. The prolonged viral shedding period is from 8 to 37 days. And it is transmitted human to human via droplets, which is why the protocol requires 1 to 2 meters distance. Now, we are fully aware that in your living and community situations, this is not realistic for everyone to exist 1 to 2 meters of distance, but you must try to do the best you can with staying apart and not being in crowded areas. 80% of infected individuals have mild symptoms, and the symptoms we will talk about in a moment. So I want to, my last comment for this slide is, do the best you can to stay at least a minimum of 1 meter apart. The clinical symptoms among confirmed cases are cough, fever, shortness of breath, dyspnea or chest pressure, difficulty breathing, chills, or repeated shaking and chills, any muscle pain or headache, prolonged headache, sore throat, and a loss of taste or smell. Now, the loss of taste and smell is a primary symptom. It usually comes before all the other symptoms. So if anyone has a loss of taste or smell, that is very suspect that they will get the other symptoms. Now, the severity of cases, which I mentioned a moment ago, are mild to moderate. That's 80% of the cases where they have symptoms or no symptoms. And even without symptoms, you could be carrying the disease. Severe cases are about 13.8% of all cases, and critical cases are 6.1% of all cases, and unknown is 0.1% of all cases. Prevention, do your part. Let's protect each other. Now, it sounds like, from what I'm hearing, you guys have a huge task and undertaking in trying to convince people and teach people that this is real. So following the guidelines that I'm giving you here and any support information that you get from Alight, these are the tools that you will hopefully use to do your teaching. I'm going to start with the slide on the far left. It shows that if someone has a cough, you should cough into your elbow, not into your hands, because you may not be at a place where you can immediately wash your hands. So if you're coughing, cough into your elbow. Keep your hands and your cough to yourself and use the elbow. COVID can linger. It can prolong itself in several hours on common surfaces. Keep your hand and sneezes to yourself. The middle picture shows COVID can't stand clean hands. COVID is, I would say, one of the biggest battles for fighting COVID is to have clean hands, and that means washing your hands. Remember when you used to splash water on your hands and call it wash? Well, that is no longer the case. Washing your hands for at least 40 seconds of real hand washing to keep them COVID-free. Let's protect each other. The protocol says to cover your nose and mouth when you come in contact with other people, especially in public areas. And any type of mask is useful. A lot of supply of masks, or they're hard to get, but you can use just about anything as a mask. I myself, I have the cotton mask that I got from the store, and they run out easily and they're very expensive. So sometimes I use this piece of cloth. You can use a piece of cloth and tie around your head and face. And this is washable. You want to be color coordinated, use any color, it doesn't matter, but the cloth is what's protecting you. So any kind of cloth mask to tie around your nose and face is very helpful. Also, for those of you who are working in clinical settings, you could use one large bed sheet, and cut the bed sheet into squares for your staff or your community or your patients. So that is just another way of protection. Guarding those hands from COVID-19. We keep talking about washing your hands. Now, when I say wash your hands, I mean wet your hands. Apply soap vigorously. Wash your hands on the front, wash your hands on the back, wash your fingernails, and really scrub using circular motion. Rinse well. Use a dry towel to get all the moisture off your hands. And what you have is clean hands. So your method of washing your hands may be a bit more vigorous. Medical masks should be reserved for clinicians, but cloth masks are good for the community. So you see here, this medical worker is using the cloth mask, and she's also using rubber gloves. If you have them, use them. It would be ideal for this little boy to also have a mask. And again, any kind of mask would be good for him, a cloth mask or pulling up his t-shirt up over his face to be close to anyone. And you can always wash the mask and wash his t-shirt. Treatment options. There are no proven treatment options yet for this new virus. It is so new, we're just trying to contain it at this point. Though vaccine trials are ongoing, no proven treatment options. We should follow your national protocols at this time. Practice self-care. You are living and working under great stress. And this is obvious from everyone that I have heard from this morning. And we all join you in living in these stressful days and times of the COVID pandemic. Think about yourselves when you need to. You are not infallible and you're working under great stress. Maintain your spiritual lives. Read your scriptures. Remember Isaiah 41:10. Do not fear, I am with you. Don't read or watch the news all day. You don't need to hear it over and over again. It makes it stressful. Regular exercises. Exercise together if you can. Exercise alone if you have to. Take a walk. Wear your mask and your rubber gloves. Laugh and smile and keep each other smiling and laughing. That is so important. I try to laugh these days as much as I can. Continue to advocate. If you have placards, you can put them up around the community. You can put them up in the organizations and places where you live and work. So you need meetings with the community if that is possible. Share the materials you get from a light. We're in this together and helping one another. We are in this together and helping one another. That is my presentation, but I just want to ask, well, not ask questions, but let you know that I know this also affects your religious affiliations, and hopefully your churches are not having communion or services or sharing any type of implements for church services. That is very important. And to all of you, I'm so happy to do this. I'm so happy to see you. I hope this is helpful, and I hope to be able to talk to you again at some point in future. God bless.
Thank you.
Thank you.
Thank you so very much, Jerry. We really appreciate your time and your expertise and your generous sharing and insights. It's so valuable during this time. Thank you all so much for listening. and
Thank you.
being thoughtful in this time. Are all, as Jerry said, we are all in this together. And it is through this that we will get through this time. I wanted to take a quick moment. Sister Irene, who some of you know and have spoken with before, shared a very beautiful message, I thought, in a call earlier this week. And I just wanted to repeat it here, sort of a closing prayer for all of us. Imagine God imagining you and smiling. Imagine God imagining you and smiling. While this will be the end of our emergency planning session, this is not the end of our connection and our support in this. What I will be doing after this call is I will be writing up the notes and the feedback that all of you shared about the challenges within your communities. And I will be providing, working with Sister Augustina, a toolkit that all of you can use within your communities that provides some of that messaging and some of that education around some of these things. And then in addition to this, I will be working with Sister Augustina and all of you on ways that Alight can support in a deeper way in allowing you all to do the work that you are doing and the support that you are providing in your communities, ways that we can further help this. If there are questions, we are here for you. As Jerry said, she would love to connect with all of you again. And so we are available for questions at any time. You can just let us know. With that, I will close the session, but if anyone has any immediate questions that they would have, we welcome that as well.
The two questions I have, one, Dr. Jerry didn't say, I don't know if I heard her saying anything about sanitizer. Sometimes I feel the chemicals in sanitizer, that they may be cancerous or dangerous to human health. Maybe she clarifies that. Then the other one, those asthmatic patients, do you think they'll be able to stand COVID-19 pandemic? Asthmatic patients, those that have asthma. So those are the two.
Did you hear that question, Jerry? So there were two questions. The first,
Okay.
the first is regarding hand sanitizer. If it is safe to use, as there are some concerns around it being okay in certain sort of levels. And then the second question was around those that have asthma.
Right, yes. Well, let me address the asthma first of all. That would be a major underlying risk factor for anyone getting, if anyone has COVID. That would certainly move them to the top of the line as far as getting treatment or wearing masks in public or washing their hands and just being very diligent. If you have, is the question pertaining to a current patient?
You said?
Do you have a patient with asthma who has COVID?
No, I don't. I was just asking. I don't have any patients.
Oh, okay. All right. Now, as far as hand sanitizer, if you have that, use it because it's better than nothing. However, I recommend soap and water to wash your hands thoroughly. Soap and water would be my first choice, hand sanitizer second. Even if you have make a bleach solution, using bleach, because you are going to have to wipe down surfaces that are touched daily, all day. And that's things around your home that you need to wash down. If you're in a clinical setting, you need to wash down the beds, utensils, any kind of equipment. You have to wash down surfaces on a daily basis. Does that help your question?
Yes, yes, doctor. Thank you very much. Thank you.
You're welcome.
I have a question.
Yes, please.
Is there another question?
Hello,
Yes,
doctor.
I have.
Yes, not a question per se.
Yes.
Can
go
I
ahead.
speak on?
Yes.
Okay. Well, it's just to say that I appreciate the talk you just gave us now. And particularly, you know, something that I found very, very striking is your suggestion that we can take up bed sheets and cut it into pieces to make a face mask, cloth face mask. That is very, very, very revealing to me. And as you said it, I'm just thinking when I get into back into my room now, there's this beautiful bed sheet that I have, white and blue. I'm going to cut it into pieces and I'll make face masks for everybody in the compound here, for the children in the orphanage, for the welfare staff, for the gardener, for everybody. Thank you so much for that suggestion. I really love it. God bless.
Absolutely. Well, it's good for all of you to put on your thinking caps and be creative and think of ways that you can facilitate keeping it from coming to Africa like it is crazy all over the world. So you guys are in a perfect place to keep it at bay because it's coming. Okay?
Okay, can I say something briefly? Hello?
Okay.
Do we still have time? Yeah, thank you so much. That for us here, like as I said, we're very busy. Like we've made our home masks. These are just the pictures of my sisters. We made our home masks. We wear because, and then most of the time, few of us could go out to do some work. So obviously, we have done quite a lot in that area. But the major challenge is the people we work with, the ministries itself. Yeah. So for us at this level, I would actually agree with the mass education. Now, there is this aspect that if you could also highlight disposing of these masks and hard gloves, because in some areas, people litter that everywhere, and there's tendency that people might actually get more infected as a result of the disposables littered around than the direct contact of the coronavirus itself. So could you actually shed more light in that area? Thank you.
Okay. Leah, are you still there?
Yes, I am.
Something's running low here. I didn't get all that. My computer's acting up a little bit. I don't know what's happening.
Yeah, so my understanding of the question was regarding access to face masks and gloves and some concerns that either not everyone will be able to have that supply, but also if they do, that some people have heard that maybe that could enhance the contamination or spread. Is that correct, Sister Gloria?
Yes, and the disposal of these masks, gloves, and there is tendency that they could be littered around, yeah? So, and then more infection spreading as a result. So in terms of mass education, in line with what we are actually going to engage people with, because in this area we are working already, but we know that Nigeria is huge and diverse, so it's complex.
Okay, regarding supply of masks, I neglected to ask you all the question of what is your contact with government organizations or representatives for getting supplies? Are supplies available from your government, your local government facilities? Do you have that kind of communication with them? And are they in a place or offering any assistance in that way?
Okay.
Does anyone have contact with government organizations for supply of masks or gloves or soap?
Can I answer that question?
Yes.
You're asking about, Geraldine is asking about our contact with government organizations and stuff like that. For us here, I'm not sure whether when I was introducing myself, I did mention the name of my congregation. I'm a sister of the Eucharistic Heart of Jesus. And here where I am in Ogara is a very rural settlement. Up till last week, we did not see the presence of any government organization here. Even though we have an orphanage, and by that right, you will expect that we will get support from the government. We never saw them for a very long time, but thanks be to God. Last week, they came from the states, we call them that, the welfare from the states, from the Delta states. They brought some foodstuffs, some material, rice, beans, and things like that for the orphanage. Then 2 days after, the local government also came, but they brought foodstuff, not mask. Then we have some individuals that have been coming, like very close to us here. We have, it's a private university actually. It is called the Western Delta University. They were here. The provost, some of the members of staff were here. They gave us foodstuff also. I think in Nigeria, for many people anyway, as at now, they are more concerned about distributing palliatives in form of foodstuff. Some are giving hand sanitizers and face masks too. But I think more of food, of what people will eat. That is what I see. I've seen some places like in Lagos where our sisters are working. I know that a group of Catholic women too donated some face masks to the Archbishop there. That's out there in Lagos. But here, I've not seen much of face masks being distributed. Rather, they're helping with foodstuff.
That is sad to hear that you have no outlet. It may be that they're not aware that you need supply. Have you all contacted your government organizations or other organizations to get supplies of masks or anything that you need for this pandemic? That how did they initiate the lockdown? How did they initiate the lockdown without giving supplies?
Geraldine, one thing you have to know is that the situation, sorry, let me finish. The situation where you are in your country is quite different from what is obtainable here. It's a different ball game altogether. Here, we could say it's something like putting the cart before the horse. They initiated the lockdown first and then started looking for how to help. So a lot of people are stranded. We ourselves, as a community here, we have had to give out things to people. We've had to give out food, oil, tomatoes, things like that to people. And as at the time we did it, oh, my network is bad.
Yeah, we can hear you.
Can hear me. As at the time we did it, okay. As at the time we did it, we have not even seen the presence of the state government or of the local government. It's after our own distribution that we saw them coming into the village. But well, that's why we need your support and your prayers.
And one thing I will add to that too is part of what this conversation will lead to is to start thinking through some of those creative alternatives that Alight can support on, given the difficult context and situation, to find other avenues and creative and innovative ways in which we can support to meet some of those needs in the community. So it's very helpful to hear the realities that you all have shared, as this will help us to create some recommendations specific to the communities and potential ways that Alight could help with that.
Yes, Sister Gloria wanted to say something.
Oh, okay, yes, okay, like COVID-19, what I had wanted to say is that COVID-19 obviously was looked at as an emergency, and in an emergency situation, no one actually had a script on the best way to actually engage and actually tackle the issue. But having said that, in Nigeria, yes, there were even government palliatives, but there were cases that even these palliatives were enriching the people that it was meant for, the most vulnerable people, or that some of these measures were actually, or resources that were cushioned for the effects of this COVID-19 were actually being channeled to some part of the country. Meanwhile, the same issue is affecting both us in Lagos. We are actually the epicenter. We have been locked down. Most of our ministries have been closed. Like just opposite me here, we have a development center where we provide skills acquisition for women and youth. Now, they cannot down as one of the measures. Okay, we have shut that down as one of the measures to safeguard ourselves and the people from getting infected with COVID-19. We also are using our creative ways of providing resources around, like the face mask I spoke about. I use my hand, the one I'm using, because I'm the one who has to go to do shopping for my sisters and all of that, and also safeguard myself. Once I come back, I go straight to my room, I remove all my clothes, I shower, I wash my shoes, and I ensure that I sanitize all the surfaces, and we have our sanitizer at the gate. But we also educate people, like that was I was talking about mass education, that if you have access to clean water, soap and water is the best. But locally, make these masks. I was happy when Jerry said, except for the clinical use, they are not fit. But for other work, we can actually use cloth to make this. I did that. I've been doing that for the past 1 or 2 weeks, and I kind of took photos with my sister, the one I had to make with the sisters that are here, even though I'm not expecting any of them to go out. But and so, in terms of food, people are actually not having access to be able to have food because they cannot work. And some of them who are able to go out to work, they might not even have that market, they might not even fall under the essential services that we are talking about. So those of them who are not even part of who are non-essential services, they have got families to cater for. That means there is no resources to be able to do this. So they are hungry. So that is why we also talk about food provision, if possible, because people are hungry, and coupled with that, the price of goods are very high, and that includes the essential goods, which is food that everyone has to live with. We know, I also engage with some of our sisters, we know in some countries they were able to have that measures in order that, okay, stay home, we give you some level of money to keep you away from, to maintain social distancing, but that isn't the reality. If we actually had to take a data or make a research, some people, I mean, there was this announcement at some point that government had to pay some money to some people, maybe 10,000 and all of that, but how many people are able to get it? Day before I went out to kind of do some survey, a woman selling banana, I asked the woman, how were you able to survive the lockdown? She spoke in pidgin English as she would always say, how will no go survive? And you will see this resilience in these women. Now, I came back and was sharing to my sisters. I bought the banana from her because of her resilience. But what she told me was that I was able to sell, but all my money went on transportation. And I'm also experiencing that based on our project, because we also have clinic in Lagos, in a very poor place, Kirikiri. Yeah, the staff, most of them can't even come to work because they have to live far away. The cost of transportation is very high. So you find those who are around to do double shifts, and that includes all the sisters. But at the same time, we're also ensuring that that preventive protocol is non-negotiable. So that's why when I say Nigeria is huge, it is diverse. Yes, what Sister Juliana was saying is very true. There are people who only hear that government have provided palliatives, government have provided all of it, but it hasn't got to them. But we know if the situation is relatively the same. So it's huge. And if we have to do something, maybe there is need for us to actually kind of have that in-depth research in terms of getting engaged with all the sisters in Nigeria, different ministries, engaging with various groups, those who are the victims of human trafficking, people who work in the school, the children, they are not in school. And we know what will happen if they have to come to school at this point. Even those of us being online, the reality is that many of the poor people could even afford to be able to buy the recharge card to recharge for internet. How many of these parents are able to even know how to even access the online? How many of these kids have laptop, even if they have to use phone? So at the end of the day, there was something when we were discussing with our sisters on online. I was also speaking with them in terms of advocacy that for the kids in rural area, they will also ask us, what about us? And at the end of the day, we might have two layers of citizens. Those who could actually go faster and those who will be left behind. So COVID-19 is a huge problem that obviously whatever intervention we need to do, whatever we want to mitigate the effects of COVID-19, we really have to be able to engage with congregations. And thank God Sister Augustina is there. She could actually, facilitate this and help us to find what actually we need to do to help the people. Thank you so much.
Thank you so much,
Thank
Sister
you.
Gloria. It's that passion and that drive that we must do more and we must reach the most vulnerable. That's what we're all here to do. Thank you.
Can I just say something? I don't know if you're able to hear me better now.
Yes.
Yes, we can hear you.
Okay. I just want to add that I am aware that the government has supplied some equipment or gadgets to some hospitals. And most of the hospitals they deal with is tertiary institutions. I'm talking from this eastern part of the country where I am. They provide this, but the other Catholic mission hospitals or other non-governmental agencies do not tend to get these things. That is just it. And we can't just fold our hands and watch. Just like as the pandemic, when we recorded a case here in this part of the country, in the east here in Anambra State, the teaching hospital, the tertiary institution here had to lock down in this area. And they only rendered services to emergency cases. Emergency cases. In fact, we had someone that, a case of burns, somebody that had burns, severe burns, and they only and cleaned the wound the first time, busted the blisters and just covered and said, go home and look for anybody anywhere who can take care of you. And it was someone that just put up a call to us if they could bring the person to us. We had to accept because if not, that person's hands and legs would decay. And she's still, as I'm talking, she's still in the hospital now with us. Even at that, there is no money because businesses were halted from operating. And I know the woman keeps crying, no money, no money. Tell me, what am I going to do? And we tell her, don't worry. And like today, I was talking with the parish priest in this area. We need to source for funds. Let's see how we can help this girl. So if government does not support us, do we just fold our hands and see our people wasting away? So we still have to do things. And that's why creatively we come up with different things. But we are open to any group of person that, any group
that comes up to say, okay, we can help you with this, we can help you with this. But we are doing things. We are.
Yes, thank you so much, Sister Jovita. We are grateful for all. I think what's the most amazing from everything that we're hearing is that in the face of such difficulty, every day, each of you shows up. You show up and you act and you do. And that is what has inspired us to connect with all of you. You are all the hope. You're the action, and you're what will help so many. And so we continue these discussions, and we will find ways that we can help support and truly reach those that are unseen by many.
Thank you.
Well, Leah, I really want to thank you. I want to thank Shamila. I want to thank Dr. Jerry. I want to thank Dr. Caleb for this initiative, this beautiful initiative. Maybe there are others I'm not able to mention their names. I am particularly very, very happy. And I want to beg, if this kind of discussion can continue, can we schedule another Zoom meeting like this again? Will it be possible?
Yes, of course. Let's talk.
Yes.
We can talk after the call about it, okay?
Okay, we'll talk about that, because I also love the major superiors, the superiors of congregations, to meet on and to have a Zoom meeting like this, and we also talk. By the time we do that, maybe this information might have gone round, the sisters at the grassroots, the leadership of the conference, then we'll come up with something, so many things that may be creative enough to help our people, because from all that we have heard, we are not getting any support, much support from our government. And we are actually having this kind of epileptic government system that is not helping us. And that is where our pain, our greatest pain lies. And so a lot of people expect from the church, from the religious, from the sisters, what the government ought to be doing. The people want us to do it, and we really want to do, but our hands are tied because we may not have enough resources to do that. But like you can see, the sisters are ready to do.
Yeah.
So thank you so much. I'm very happy. I'm happy with Leah. I'm happy with Dr. Jerry. I'm happy with Shamila, Abby, and the others. Thank you so much. I'm really very happy.
Thank you all so much. Maybe we can just give a big wave to each other before we sign off.
Thank you. God bless you. Thank you.
Thank you all. Thank you.
Thank you.
Thank you all. We will talk again soon.